Let's talk about some general terminology related to anatomy and physiology. First of all, we refer to the axial region of the body, which is really the head, neck, trunk, abdomen, and pelvis region, so the main trunk part of the body. And we refer to the appendicular region, which are the arms and the legs. As far as orientation and directional terms, when we talk about where something is in the body, we use a certain set of terms, and you should be very familiar with these terms. So practice describing where something is using these kind of terms. So first of all, superior, we can also use the term cranial, means toward the upper part of the body, the head, or above something else. If we say the heart is superior to the stomach, we mean that it's on top of or above the stomach. Inferior or caudal means away from the head end toward the lower end. So underneath, towards the lower part of the body, is inferior. Anterior is toward the front of the body or in front of something. So the example here that the breastbone is anterior to the spine, in front of. Posterior or dorsal means to the back of, behind. Medial always means toward the middle of the body. So the arm is lateral or away from the midline of the body, but the heart is medial toward the center relative to the arms. So usually we use these terms comparing one to another, medial to something else, lateral to something else. Proximal means closer to the attachment to the body. So the upper arm is proximal to the fingers. Distal is further away, so the fingers are distal to the upper arm. So we're comparing things relative to each other. We also talk about sections or views of body planes. And the first one is a coronal section or a coronal plane. That means that you've cut vertical and the body you're seeing in anterior and posterior parts. So a coronal plane can also be called a frontal plane, where you kind of cut the body into frontal and posterior, anterior and posterior parts. There is also a median plane, which cuts down the middle of the body, dividing it into right and left sections. It doesn't have to be in half, but if it is in half, we call it mid-sagittal, divided the body into exactly equal right and left sections. You can also have median sections of, say, talk about a median section of a finger, where you're actually looking at the two halves of the finger. There's also transverse planes. They run horizontally and divide the body into a superior and an inferior part. For example, you might look at a transverse plane of the arm, which would show you kind of a cross section of what muscles run through, muscles and bones run through that portion. Cavities. So let's talk about the different cavities that you find in the body. There's the dorsal body cavity. Again, dorsal means back. So the cranial cavity is where the brain sits, and the vertebral cavity is where the spine is. You can divide, so in yellow here you see the cranial cavity and the vertebral cavity added together. Those are dorsal body cavities. The thoracic cavity has the heart and lungs, so that's the cavity in the upper part of the thorax. The diaphragm divides the thoracic cavity, so the thoracic cavity is above the diaphragm. Below the diaphragm sits the abdominal cavity that has the digestive organs, the stomach, the liver, the intestines. And below that is the pelvic cavity that contains the bladder, the rectum. The thoracic cavity and the abdominal pelvic cavities are all considered ventral body cavities, or kind of in the front, whereas the cranial and vertebral cavities are considered dorsal body cavities. All of these cavities are lined with membranes, and we'll talk a lot about these membranes. The membranes that line the body cavities have two layers. And between the two layers is a fluid that allows the layers to kind of slide past each other without providing friction. Here you can see a transverse section of the abdominal cavity, where you can see how the visceral layer of that kind of lies against the organs, and then the parietal layer is generally the outer layer. So you have the two layers, and then you have fluid between them.